My family's really excited that I've gotten off the streets and I'm a whole different person now. And I've changed a lot since a year ago. If you were to see me a year ago, I probably wouldn't want to talk to anybody. I probably wouldn't want to do anything. Probably still doing drugs, probably be in jail, you know. And now, like, my life's so much better.
People have to, I guess, get awareness. Like I said, like, I had no idea of the situation until I was down in the situation. I was a regular 9-to-5-er before, and I never thought about homelessness. I never thought about poverty. It wasn't a concern of mine.
Oh man, what a difference. Walking around with a plastic bag over my shoulder constantly all day. I mean, that's real. I mean, people walk around with shopping carts and stuff like that, and you know, that's their whole houses right in there, right?
It is almost impossible to get out of the downtown east side once you're there. If you make a mistake and have something bad on your record, you can't get into public housing, you can't get into the mental health housing system, and really a significant amount of the housing will not take anybody who uses any kind of drug at all, including marijuana. So it becomes extremely difficult to house people outside of the low barrier housing that exists in the downtown east side. And so no matter how much you fight for people, you just can't move them out of the area.
It's ridiculous for people to be asked to get their lives back on track or get clean or go to school or all these things when they don't have stable and secure housing.
What we have found in our project is that moving people into more calm, stable environments alone has provided a huge difference in people's outcome. And that we see a huge amount of reduction in sort of difficult behaviors just by moving them into a nice apartment in a nicer part of town.
At least in Vancouver, this is a group where traditionally there hasn't been a lot of choice when they're offered housing. This is the first time that I know of where people have really been offered a choice of which neighborhood you want to live in, which apartment you want to live in. Housing First is an approach to providing housing to homeless folks where you don't have any conditions. And the housing component is exactly this scattered site housing model where rent supplements are available that allow people to take their income assistance check, combine it with a rent supplement, and rent an apartment somewhere in the city. And again, it's very choice-based. So that was sort of the innovation that Pathways brought. Philosophically, they brought a harm reduction approach and a strong commitment to recovery principles such as self-determination and choice.
I felt really like they were giving me the option to choose my lifestyle. They didn't actually plant me in a place where I'm not going to be happy.
I was really happy that I could actually live in the neighborhood that I'd made all these friends in. I didn't have to leave that area. That probably made one of the key decisions in actually accepting their help and stuff.
We can't really exist in vacuums, you know, or silos, and so I probably wouldn't leave my house or eat or start anything new or have started a business without my community.
There are people that know that maybe full-time work isn't possible and then they're interested in part-time or volunteer, but almost everybody wants to do something productive.
Every small, medium, and large-sized business in Vancouver should have a local hiring policy. At the end of the day, it's really personal, and it's that me, Megan, met Wesley, who loves plants and is really ready to work.
Just because a person at one point looks like there's no chance this person's ever going to recover, we shouldn't just give up on them and maybe just feed them as much drugs as we can until they die. Bring them indoors, nurture them back to health, and see if the person wants to be healthy. I think everybody out there at least deserves that kind of a chance, right?
Within the backdrop of how humans lead their lives, it's quite normal to have transitions. So it's interesting for us to watch how people are grappling with that transition. And for some folks, it's probably a little easier, and then other folks, it's more complex.
We have this idea of like, oh great, you get housing and everything's better. I think kind of like when you think people win the lottery, like there's still, life problems still exist.
My intention when I first moved in was just to get my teeth done. I had to be inside to get my teeth done. And I go in on Friday to get my teeth up, tops and bottoms, full plates. And I wouldn't have been able to do it if I was homeless. There's no way I could recover out there.
You know, maybe part of the experiences that I've had so far might be enough to tweak a person into thinking, well, if this fella is changing in this direction, then, you know, who's to say other people won't too?
People need to have some reminders that, like, it's okay to look and sound different in our community. I think that people need to be reminded of really basic stuff, like look at people and smile at them. It's maybe a given in some areas, but it's not a given for our folks who are routinely dismissed or discounted and ignored. So when their neighbor says hello to them or smiles at them, that means a lot.
You can't take advantage of things or you lose it.
One of the things that happened to him when he was homeless was a group of teenagers stood around him in a ring and threw firecrackers at him quite gleefully. And, you know, it's difficult for a parent to go to bed at night and wonder what the hell is happening with their child.
I've almost choked to death 15 times, I'd say, from not having my teeth. Eating by myself, not chewing, swallowing whole, getting stuck. It's very scary.
In mental health, you know, like I'm a psychiatrist, so we can provide meds and things like this. But people don't really get better with complex needs with solely just seeing a psychiatrist. They need this system around them. So the mental health needs, the other kind of agency needs are all taken care of. And you fail to get people better if the system that's supporting you is not very good. And so the system is flawed, you know, and it's seriously flawed in BC and probably most of Canada. So ACT is Assertive Community Treatment. And this is a model of care that's actually been around since the 70s, believe it or not. And it can be very intensive, and it covers kind of all areas of their needs. So people, if they need substance abuse treatment, they get it from the team. If they need a psychiatrist and need medications, they get it from the team. If they need help with social work stuff or getting money or anything like that, it's all dealt with and serviced through one group of people.
While we have a big team and there's lots of staff that people have to get to know, I think they still have some comfort and security that it's still one place. You know, and if they come and that person's not there, they can still see someone else. It's not a wasted trip. Whereas if service is scattered amongst different agencies, and then different agencies have different rules and things like that. So we just really strongly believe too that people shouldn't have to jump through a million different hoops to get the support that they need either.
Really, our model is not to put people in housing and get them mental health care. Our model is what they want. But I will tell you that most people along the way get mental health care or get addiction care or whatever else to reach whatever their personal goal was. But we try and focus on what the individual's goals are and start with that. And it's very effective, particularly if you really listen to what they want.
Since I've been in there, I had the opportunity to get a couple of poems I had written published, and that's one of the best parts about being indoors, is that I can be confident to do those writings and that I won't lose them. You know, there's no chance that the rain is going to wash the words away anymore.
He's doing better than he's done in 30 years, let's put it that way. He's just, he's fun to have. So it's brought us together as a family where we weren't before RainCity. We just weren't. It was always in the back of all of our minds. Where is Cam? What's happening to him? What can we do? Like, we just didn't know where to turn.
Maybe this model can be a major part of how we respond to homelessness. Right now it's not. But in the future we can imagine a future where it is a major part of how we respond to homelessness. And I don't believe it should be the only model. There's a lot of good things we're already doing in Vancouver, and we need to keep those things and build on those things. But this definitely should be added to what we're already doing.